Now, if the global pandemic has taught us anything, it's that good health care should not be taken for granted, and yet millions of people in this country still can't afford it.
Denver 7's Russell Haythorn explores a relatively new idea tonight, purchasing alliances and the power of pooling resources so more of you have access to affordable insurance and quality care.
For Millie Shoemaker and her family,
we live in a beautiful place.
Life in the Colorado Rockies got a little sweeter 6 months ago with a new baby who came into the world much cheaper than older sister.
The biggest benefit that I notice is we're paying less money.
Millie and her family are part of a new healthcare alliance in Summit County called Peak Health, a purchasing alliance.
I had a baby 2 years ago with a different health insurance, and I pay way more than with my last baby that I had 6 months ago.
Millie's first birth was $10,000 out of pocket. Her second, half that, at about $5,000 out of pocket.
Here's how purchasing alliances work. The alliance, in this case Peak Health, goes to local hospitals and negotiates for lower prices on care ranging from childbirth to knee surgery. It's especially effective in small towns, in this case Silverthorne, Dillon, Frisco, and Breckenridge. Then the alliance acts as the go-between for insurance companies and you, offering you the ability to purchase packages at a much lower rate, sometimes saving families hundreds of dollars on their monthly premiums.
For me, this has always been about helping to create relief for my friends and my neighbors.
Tamara Pogue is the CEO of Peak Health Alliance.
We were looking for solutions that we thought would make a difference that we could control.
Pogue's nonprofit collected all claims data in Summit County, part of public record minus patient names, worked with Summit Medical Center to renegotiate rates, then worked with Bright Health Insurance to lower premiums for families.
We've cut their insurance in half.
The average family of four's monthly premium
has gone from paying about $2,500 to about $1,200.
Families or individuals buy into the alliance at just $6 a month, but then end up saving hundreds, if not thousands, on their premiums.
It's a really, really good price.
Ken Maldonado went from paying about $800 a month on health insurance for himself down to $460 a month.
The more people they get enrolled, the greater buying power they're going to have. I tell anybody who's independent up here to call Peak.
Peak's members include individuals, families, and small businesses.
Fundamentally, the way these things are working is, you're aggregating demand.
Chris Luby is a professor of healthcare management at Metropolitan State University of Denver. He says hospitals value these alliances because the alliance steers business back to the hospital, not to their competitors.
I have a better idea of what might be coming in and becomes more predictable.
Then, the more volume the hospital does, the less they can charge.
I think that it's important that they consider how they can bring the hospital to the table.
Sharma Vaughn is the executive director of the Community Care Alliance on the Western Slope.
In rural communities, everybody depends on everyone else.
Her alliance is unique in that it represents actual hospital employees who need health insurance just like the rest of us.
Hospital leadership said, as an employer, we're having a tough time with this health benefits conundrum too. Hospitals are usually about a third of the local economy.
While these alliances are working really well in rural communities, they are still scarce along urban corridors like the Front Range because there are much larger hospitals, bigger companies, and it's generally harder to build consensus around out-of-the-box ideas, even though Sharma says it shouldn't be.
When we align our goals, even if we start from different places, we can achieve a lot.
Peak Health has now expanded from Summit County to 6 other mountain counties, and Pogue is convinced it could work for larger hospitals.
And we said, look, we want you to be part of the solution. You tell us how you can offer lower prices. And they did. When you hear stories about moms that can't take their kids to emergency rooms for a flu test or right now for COVID treatment, it's terrifying to me.
For those like Ken, it's a game changer.
To have that type of a program here in Summit County is awesome.
Millie speaks for all new parents hit with baby bills.
That sucks that you have to think about that when you're having a baby.
In Summit County, Russell Haythorn, Denver 7.